everybody. I'm Vicki Liviakis. Welcome to Body Beautiful. This is a show where we talk with local professionals about the latest and greatest in cosmetic procedures and medical devices. We also take your calls live on the air. And with us today, we have plastic surgeon Dr. Elizabeth Lee. Later, we'll be taking your calls, answering any questions you might have about plastic surgery. We're kind of really concentrating on tummy tucks, but she knows about a lot of things. Here's the phone number, 800-440-4884. We'll also be posting the phone numbers to the guest office, so be ready to jot those down. And before we get started, any advice we give you today, you're always going to want a second opinion, right?
Exactly.
Welcome back to the program, Dr.
Thank you.
Lee. You know what, people, some of the best stuff is when we're talking behind the scenes. I mean, about the reality of plastic surgery. And before we get in to talk about tummy tucks, it is about aesthetics. It's art. And some people are good at it and some people are not so good at it. You as the artist, the sculptress,
I think that to look at it another way, there's a lot of plastic surgery out there that's visible. So what I like to think about is the fact that I want my patients to go out to look great, to have people say, hey, you look fabulous, but what'd you do? Not to say, oh, who did your eyes?
Right. Yeah. Well, or like, you know, as you talked about one patient, you know, did you change your hair? You know,
exactly.
Where you can't see it, you just know the person looks better.
Right.
Did you get some sleep tonight?
Right. And she came in about 2 months post-op from her neck lift and said, everyone thinks my hair is fabulous. And I said, your hair. And she said, perfect. Yeah. They look at me, they say, you look fabulous. It must be your hair. And that's perfect.
That's the answer you want to hear.
Exactly.
Now, and what we were talking about off screen was about, you know, because we're fond of dissing Los Angeles and Hollywood. And, you know, sometimes, I mean, you really can tell that someone has had work done. But in a way, I mean, you think, well, they can afford to have the best. Why did they do that? Well, explain what your theory is.
Of course, I'm not in the position of working with these people, so I can't know for sure. But my theory is that patients will often come in with a specific problem that's bothering them. For instance, the lines here. And they'll say, I want these gone. And it takes a fair amount of working with somebody to say, you know, they should be softer, but gone is not the right thing to do. And I wonder if people in Hollywood, if celebrities are used to being talked to that way, and if the celebrity physicians or the physicians taking care of them are willing to step out there and say, I know you want your eyes to look a certain way, but when we put your brows all the way up here, you're going to look odd.
Small children, and yeah. So you know, just tell them to stop, because there is that other, you know, addiction to plastic surgery.
There is, and I have to say that fortunately there's not a whole lot of this up here, but it's very important when you're working with a patient to set their expectations appropriately and to make sure that you're understanding what it is that they're looking for, and then that they understand what it is that can be done.
Okay, what about reality show plastic surgery?
It's an interesting thing, because there is no question that the shows like Extreme Makeover and Dr. 90210 have raised the public's awareness of what's possible. I think, though, too, that that those shows give a very false sense of what plastic surgery actually is in terms of recovering from it. So when they do these, you know, extreme makeovers, they take patients, they operate on them for 10 hours, they show them moaning a little bit in recovery room, and then they show them later, you know, 4 weeks later, and they miss the really hard part.
Which is the healing. And yeah, okay. Boy, you're the truth doctor here today.
I'm trying.
Yeah, well, thank you very much, and we have a lot of calls I want to get to, but we need to take a very brief break. But